not just anecdotes or not just this, this little change on the test. They're pretty sophisticated, but not if the doc knows what they're doing. And as far as medications killing that creative spark in a bipolar person, when someone is manic or hypomanic, if they're hypomanic, without much disability, as I discussed before, I think carefully about giving a drug that could decrease their creativity. Absolutely. But if they are manic, you have to take the risk of reducing their creativity and give them a medication because, number one, for every manic episode they have, it increases the risk of another one coming sooner and being more severe. Number two, the manic episodes can produce brain damage. Number three, if they're left untreated, it can absolutely wreck your life. You can be in and out of hospitals, psychiatric hospitals or jail for years, or you can end up dead. And to me, the medication benefits outweigh those enormous risks I just enumerated.
Okay, thank you.
Yes.
Looking at children and adolescents, is their diagnosis and treatment more complex because their brain's developing? Does it take longer?
Their treatment, their diagnosis and treatment is a lot more complex. Not just because their brain is developing, but because certain childish behaviors are normal. Kids sometimes have temper tantrums, and temper tantrums do not make a bipolar diagnosis. There's a huge argument in psychiatry about whether this is overdiagnosed in kids. It used to be underdiagnosed. Bipolar disorder does exist in kids, but it presents differently. And this is a big problem in the DSM. Because the DSM forces, I can exist in kids, same criteria as for adults. That's nonsense. Kids are much more likely to have more rapid mood shifts, much more likely to be irritable, much more likely to have screaming temper tantrums that do not go away. It's just different from the adult presentation, and it's a lot more rare. Okay? So that is going to be a big change in the DSM-5 in 2012. Mark my words. Experts in child psychiatry know this. And if you suspect that your child has a bipolar disorder, my advice to you is see a competent child psychiatrist, even if you have to go to UC San Francisco or UC Davis. Do not leave this diagnosis to your pediatrician. I'm pretty good at this, and I treated a lot of kids. But I refer to a child psychiatrist who see a lot of these kids. All right, am I ready for the basket? Not quite, I guess. Yes, ma'am.
Well, I have a question about relationship ability. Does having a mood disorder that kind of takes your attention, distracts you from moving forward sometimes in life, does that ever inhibit the ability to make good friendships, social connections? Do you see social skills as one of the things that is on your list of things?
The short answer is yes. It's not in the diagnostic criteria, but it frequently impairs social relationships, either on the depressed side or the manic side. If someone is mildly hypomanic without disability, they are likely to have a lot of friends, be very social, maybe have a lot of lovers. But if they are any more than hypomanic and have moderate to severe hypomania or mania or severe depression, that is going to affect the relationship severely. Manic episodes often wreck friendships. People will get tremendously irritable and start paranoid sometimes during a manic episode, and people lose friends over it. Similarly, somebody who's chronically depressed has a dysthymic disorder, it takes a really good friend to hang in with this person for years if they're just pessimistic, always feeling ill and fatigued, and so on. Similarly with major depressions, it's tough to stick with people. And so, yes, it does affect relationships.
So what would be some of the things that you would suggest if it's not,
I would
not
suggest-
able to take pills for that necessarily?
I would suggest treating the underlying disorder. If it's caused by medical condition, treat that. If it's a major depressive or hypomanic or bipolar disorder, treat that either with combination of psychotherapy and meds or meds alone. Because as these conditions are successfully treated, people's social functioning improves. That's why it's often good to get both meds and psychotherapy. Time and again, the research has shown that that is the best treatment for these disorders. Simple as that, it's the best treatment. Yes.
I want you to get on to paper questions, but I have a question.
Yes, ma'am.
Is it the child in me that causes my screaming episodes and my temper tantrums?
That's a complicated question, and it's not simply answered.
The phone company.
It can be a lot of things that can be causing that. It can be a lot of different things that can be causing that, which we don't have time to sort out here.
Yeah.
Yes, sir.
I was diagnosed with BP1 quite a while ago, and they threw about every medication in the book at me, and it didn't work too good, and I ended up with a whole bunch of side effects.
How long ago was that?
Around December, last December.
So-
I went into a major depression, and my psychiatrist wanted me to try ECT, electroconvulsive therapy.
No.
So I got checked in to the Sutter Psychiatric in Sacramento in December and did about a 13-day stint and got zapped a whole bunch of times. And now I've been zapped about 21 times. And I think it has definitely pulled me out of the depression, but I'm still getting the irritability and difficulty communicating, thinking clearly. The cognitive reasoning is a little tough, and they said that might be part of a side effect of the ECT. And I'm on less medication now, just lithium and Lamictal and Seroquel right now, and getting ECT once a week. So I just wanted to throw that out there, see if there's any fellow ECT recipients out there that I could perhaps compare notes with. That's about it.
Do you have a question?
That's
Just
feeling. I'm just putting
okay.